Welcome to Season 3 of the College Admission TV podcast. We explore the fast-changing space of AI, education, and the future of the workforce. In this episode, we're joined by President Mohammed Abousalem of Keck Graduate Institute.
Welcome back, everyone. Where innovation meets impact. I'm your host, JP Novin at Plexus, and today we're diving into one of our most urgent and exciting frontiers in higher education, the intersection of AI, education, and the future workforce. In this episode, I'm pleased to have Dr. Mohammed Abousalem, the relatively newly appointed president of KGI and a veteran of global innovation leadership. KGI, Keck Graduate Institute, is a trailblazing institution in the heart of California life science ecosystem. And it's not just educating future scientists and healthcare leaders. They're engineering a bold new model of learning, of integrating AI, biotechnology, and entrepreneurship. Dr. Abousalem, welcome to our podcast.
Hello, JP. Thank you very much for having me.
President Abousalem, I'll jump right into this. What do you think is going to be the impact of AI on the future of workforce?
Well, speaking from KGI's perspective, which is applied life sciences and healthcare, the impact is not really only in the future, it's here now. So we see the impact and the value of AI in a lot of aspects of applied life sciences and healthcare, things like drug discovery, things like diagnosis, treatment strategies, healthcare service delivery. All these are areas where AI is being used already and showing a lot of promise for productivity, efficiency, and we all need that. So there's that impact, and I think it's an opportunity for our society as a whole to embrace that revolution, if you will, and that opportunity with those technology tools that we could use to our advantage. Now, of course, as everybody says and everybody talks, there's an impact that is seen as a negative impact in some cases where AI may replace some of the professions, and I would say, or the jobs. I would say that will happen with some jobs if they remain defined by their scope or need of the past. But there will always be opportunities for jobs to evolve. And I'll give you an example, very simple, when you look at real estate and how realtors worked in the past before the advent of the internet. Now, the internet came, they had to evolve and change the way they did business, but we still have realtors. And in fact, the internet for the real estate industry helped create even the demand or need for new professions or advanced professions like photography and videography to support real estate on that new platform. So I would say by far the impact of AI is positive. We, though, have to make sure that we are using it ethically, that we are also not replacing the human judgment or the human validation piece as we use AI tools, especially in healthcare, where the human touch will always continue to be important.
Just looking at everything KGI is doing, you have the AI facilitated research on radiation exposure. You're dealing something in interdisciplinary AI research initiatives. You have a lot of collaboration with the industry through team masters projects and through your alums. So KGI is doing a lot of interesting, groundbreaking work. So I guess this question goes far beyond what steps are you taking to integrate AI awareness and skill. I think the question is what steps and how are you planning to introduce AI into healthcare and your pedagogy as a university?
Yeah, so as you said, AI already exists in our activities, in our curricula, in our engagements with industry. KGI, as you know, JP, we are a graduate-only institution that is offering masters and doctorates in applied life sciences and healthcare. So by definition, we are a STEM institution, which means that technology is part of everything we do. And AI is included in the different courses and programs depending on the focus of that program or that curriculum. Now, when I joined KGI a year ago, one of my observations after I had done my listening and learning tour with our stakeholders and our community, my observation was, how do we pull the efforts that are already taking place in the different programs and activities, how do we pull all that together so we can give it focus for an AI strategy for the institution? So one of the first things we did is we put together an AI steering committee for the institution. And that committee is made up of faculty, staff, students, and industry advisors. And the goal of that committee is to help us with that holistic view of the use, utilization, embracing of AI in the institution, in the curriculum, what elements and that are included in the curriculum to ensure that our students are graduating with the knowledge they need to be successful in the workforce. Also looking at the technologies that we're using in the classroom or in the lab or even in our business operations. How can we embrace AI for the value it brings as far as efficiencies and effectiveness in what we're trying to do? Also, I want the committee to look at recommendations for the institution as far as policy of how we use AI, how the students can be encouraged to use AI, but also the security and privacy aspects that come with it. Also, one of the charges for the committee is to look at how we educate our workforce, our employees, our staff, our faculty. How do we educate them so they can embrace AI effectively and efficiently? And I would say also one other aspect of the committee charge is resource allocation. When you decide to adopt the technology, you have to spend money. So, and there's a lot of AI opportunities and platforms out there. So we will need some institutional guidance on where to invest for the future. So that's one big mechanism that we've just established to help the institution to look at AI holistically. Now, when it comes to the actual curriculum, of course, as you know, faculty own the curriculum of their programs. And we've given them the flexibility to determine how they will incorporate AI in their curriculum depending on the focus of the program. But all in all, our faculty have already been using AI in some programs and are encouraged to increase that content, especially that we as an institution, one of our features or hallmarks is our tight connection with industry. So industry plays a big role in the education process of our students. So we want to make sure that even the practical training that our students get, that experiential learning that they get, is using the technologies that they need to be familiar with. So when they graduate, they're ready to work with these platforms. So there's a lot of aspects there. And there's even that piece of the readiness of the faculty to use or utilize AI. One of our priorities that we've defined over the past year at JP is advancing our academic excellence as an institution. KGI has been, at the forefront with the education of applied life sciences and healthcare professions, and we want to stay there at the forefront. And one important lever, if you will, to keep us there ahead of everyone else is to make sure that our faculty are well trained and are prepared to embrace this opportunity with the technologies and everything else. So we have a faculty development program that incorporates many aspects, whether a learning academy or online courses or even in-person workshops on campus. And a lot of the content of these platforms is now geared toward AI and the use of AI, whether for instruction, student assessment, or incorporation in the curriculum. So we're doing a lot of things as an institution, and we're trying to pull all these pieces together so they can be sort of guided by an overall strategy of embracing the ethical utility of AI.
But you having been a geomatics PhD student, you've been dealing with data for a long time. Obviously, this is nothing new to you. I love the word autonomy that you're providing to your professors. That is music to the ears of anyone in higher education. I guess if you have to think about the healthcare industry, which fields do you think, if they continue, as you said, the way they are, we might see some disruptions and displacement in the next 5 to 10 years, more immediately versus others?
Well, I would say, I want to answer that question from the proven, from the lens of the proven value of AI already. And what I mean by that is look at drug discovery and how much time it takes to develop a drug, to determine, to decide on the right formulation of the drug that's going to address the disease that you're looking at. And that process of drug discovery is a trial and error process. So in addition to the human, component in there, whether that determines the speed or even, mistakes that are done along the way or the time it takes to interpret the data, in addition to that, there's that trial and error time that you have to have. AI has proven already that based on the data that has been available and is the data banks, if you will, you could really effectively and efficiently determine those drug formulations that you need. So you're saving time, but you're essentially saving lives faster because the faster you get the drug out, the faster people heal. So there's a lot of value in doing that. If you do not embrace AI in drug discovery, your drugs will be late. Others will be embracing AI and will be faster to market than you, and therefore you will even miss that opportunity from a business sense, if you will. But also look at the data that is available in the take, for example, oncology and take like imagery and scans. Again, we have very skilled technicians and professionals and doctors who can assess what those images say. But having that wealth of data from those different images with false positives or false negatives that have been determined over time, and you put all that in a bank, then you can automate the assessment or the analysis of those images. Again, you do it faster and you do it with less mistakes, or you do it more accurately. So it doesn't, though, take away the human value of this, because anything that the machine will do for you, you have to validate it. You have to make sure that this is the proper interpretation of the data given other circumstances or other parameters. And when you develop the treatment strategy, you have to take into account also other aspects, the patient themselves, their social setting, their characteristics. So how do you develop that treatment strategy that might start with an AI component, but you will still have to adapt it to the human that you're dealing with? So again, you have to look at how can you improve the delivery or the quality of the service by incorporating AI, because again, if you don't, then you're missing out on the accuracy or the speed of that service. So these are just examples.
So I'm going to ask you a question regarding pharmacy, just because my wife and daughter are both pharmacists, so I have some experience in this. It's an ongoing discussion. So once upon a time in America, American pharmacists featured soda fountains. This continued until early 30s. It was a big part of the revenue stream until it was displaced by, fast food and the vending machines and what have you. So Keck obviously offers a PharmD degree as well. We won't get into the big beautiful bill now and the cap on graduate funding. That's a whole podcast for a different time. But let's zoom into pharmacy as an example. So if you're a retail pharmacist, what should you be concerned about? And where are the opportunities as an example?
So before I answer that question directly, I want to say that even retail pharmacy is only one area of value or operation or opportunity for pharmacists. And I just want to say that because at KGI, our pharmacy program is set up with a curriculum that trains pharmacists to be retail pharmacists or to be clinical pharmacists as part of the healthcare system or to be part of the industry. And in these three different contexts, AI plays a big role, and it is an opportunity for pharmacists there. So if you look at it from the very basic and simple operation of a retail pharmacy, and you have the pharmacy standing there, AI can play and does play a role already in how the medication is prepared, packaged, labeled, and ready for the pharmacist to hand to the patient. Now, that's the automation of filling a prescription. But the pharmacist is there for, again, the human validation and for the human connection to provide the advice and guidance to the patient. So you do not lose that value of the knowledge, the human knowledge and the experience of the pharmacist, but you could still use the technology to speed up your operation, to make it simpler, more efficient, and less costly as well. So that's from a retail perspective. And you can have a similar experience, when you look at, a clinical pharmacist and how they manage the coordinated healthcare process, the pharmacist with the primary care physician and the specialist, and how the data is compiled, how the analysis is done, how the assessment is done, and how information is shared. All these pieces include the opportunity for AI to provide input and tools for the healthcare group. And then we spoke earlier about the drug manufacturing and the drug discovery, and the bioprocessing piece would be in the pharmaceutical context, with the pharmacist being involved in that work.
Now, specifically around healthcare, there are a lot of regulations. You have HIPAA, you have high tech, you have FDA regulations. In fact, most recently, FDA introduced AI and digital health guidelines about algorithm transparency, model retraining, bias and fairness in AI. So there's a lot going on. Do you see healthcare having a more latent, as far in terms of job market and the workforce impact as regards for two regulations, and how AI could actually impact the proliferation of robotics and AI in some of these industries because of these regulations?
Well, these regulations are obviously very important, and how these regulations evolve is actually a learning process, because you get to assess the tools of today and the uses and how these tools are developed, how they're assessing or processing data to determine what was missed categorically, which could be ethically, socially, politically, financially, amiss. So you're going to be self-correcting along the way in the development of the tools, but obviously the policies that go with them. That's gonna happen, for a very long time, and to make sure that privacy issues are addressed, biases are mitigated when it comes to the data and how you're using the data and for what groups and what populations and everything else that you've listed. Having said that this is going to take some time to be learned and to evolve. Today, employers out there, whether it's industry or healthcare providers, are looking for technology savvy workers or workforce. And before even embracing the term, artificial intelligence or AI, technology has been around. The internet, computers. Look at a medical doctor's clinic and how much technology they actually use to deliver their services. So technology has been in demand in these professions forever. And whenever you have technology, whenever you have data that is pertaining to patients and their health, privacy has been a concern for a long time. And I would say employers today are demanding that literacy with technology. They're demanding graduates and a workforce that can learn over time as these technologies evolve. And that's where KGI's value kicks in, because our academic brand includes this aspect of teaching our students how to learn, teaching our students to learn in teams, teaching our students to learn through interdisciplinary collaboration. All these pieces are necessary for a lifelong learning process. And we pride in graduating our students with that knowledge and skill, with critical thinking, analytical skills, even passion for learning, so they can evolve as these technologies evolve on the job.
Now, you're part of the prestigious Claremont University family. Am I correct? The KGI is. And how does the board structure work there in terms of, do you have your own independent board? And to what extent is AI being discussed in your strategic planning?
So we are part of the Claremont colleges, and that is a consortium of 7 fully independent institutions, nonprofit institutions. We are independent in the sense that we don't have a system that connects us for operational aspects beyond the collaborative shared services. So we are a consortium, we share services. It's a way really to provide our students with the experience of a small college, but with the resources of a large university, because we share those resources and we share the services. There's a number of, so we are 5 undergraduate institutions and 2 graduate institutions. And each institution has a focus. And as I mentioned, KGI's focus is applied life sciences and healthcare professions, graduate degrees only. We are the youngest and the smallest member of the consortium. We're only 28 years old. And in higher education, we're, by the scale of higher education, this is a very, very young institution. We have several mechanisms that connect the consortium or the member institutions together. At the academic level, we have the Academic Dean's Council, and they connect discussing different strategies that would include AI, not just the content of the curriculum, but using AI for instructional delivery, using AI for student assessment, and other things. We also have a President's Council where the 7 presidents meet on a regular basis to discuss strategic and operational matters, including the evolution of education and learning and instruction and many other many other matters. We also have the student deans connect together from the 7 institutions to also look at the student experiences and the opportunities to collaborate to provide, a more holistic student experience at each institution. So we leverage that consortium to the extent we can to bring all the minds together strategically and operationally with the shared services. But at the end of the day, we still operate as fully independent institutions.
It's a federalist system.
Yes.
in a way. I know you've mentioned some of this, but I want to kind of ask this in one full question. Have any academic programs been added, modified, or retired in response to AI?
As a graduate, so let me tell you the straight answer. No program has been retired because of AI. That piece did not happen at KGI. Now, adding courses and modifying courses or programs is our continuous operation at KGI, for or with AI or otherwise. Being a graduate institution and our programs being professional programs, we are continuously assessing the content, the curriculum of each of our programs. We're assessing the program design and the instructional delivery of each program, and AI is definitely an important component. And depending on the type of program or a degree or a certificate, that content changes over time. On a regular basis, we modify the programs, and we have modified and updated programs to increase or change the AI content and other things, not just AI, to make sure that our students are at the forefront of knowledge that they need when they graduate. Now, we don't do that in vacuum. In fact, most of our faculty already have significant industry experience. So they are able to provide that input on the curriculum and how it should be shaped to align it well with industry. Also, we have a very strong relationship with industry through many mechanisms. We have 3 industry advisory boards that help us with the different programs that we have. And one of their functions of those industry advisory boards is to provide guidance and input and advice on the curriculum, on the student experience, on the technologies that we're using. So we embrace that on a regular basis to make sure that our academic offering continues to be excellent.
As a graduate program, how do you see accreditation or even the formulation of degrees potentially changing as a result of AI? So could there be different packages potentially? And, in general, do we see degree granting institutions and the link by which they give degree changing as a result of AI?
I would say AI will help tremendously in the delivery of a program, a course. So that's the operational piece of a course or a program. But we got to also think that learning is going to have to be done by the human who is the student. So AI will have an opportunity to make the learning experience efficient enough, yet we got to make sure that the student has the right time, opportunity, processes, and experience to learn. And we found that at KGI, one of the most important components of learning is that engagement with the other students. Active learning and engaged learning with hands-on education. We actually, as I said earlier, we teach our students how to learn. and it's the learning by doing in teams. In fact, if you come, and I hope you come sometime soon, JP, to visit our campus, you're going to find that our classrooms, many of our classrooms are set up with round tables, and the students sit in round circles. Even during an instruction, like even when a faculty member is teaching the students, because the teaching process and the learning process is set up for our programs to be an engaged learning process where students help each other in the conversation and in the digestion of the material. So you may be able to enhance the instruction with AI tools, but you still need that engagement opportunity for the students to learn by doing. So that's going to be important. The other thing is, as an institution that is looking to maintain and always improve the excellence of the academic content that we offer our students, we are planning and we are in the process of even adding, AI seminars, AI courses, AI, this and that. But the intent is always not to replace the basic science that we teach. These are going to be complementary components to the curriculum that we have to enhance the overall offering. And yes, there will always be those new courses, new programs coming out that give a certain focus, for a certain area. We are already looking at pulling together perhaps the different AI content that we have in the different programs and courses and putting them together as a course, like a seminar series or a course that shows how and demonstrates how AI is being used in applied life sciences and the different healthcare professions.
I was reading some data regarding KGI graduate students. It looks like over 90% of them are securing jobs within months of graduating. Now, you're in a great position. Your graduates either have had jobs or they're graduating into jobs of high demand, fields. But as you think about those sister organizations within Claremont, let's say those in humanities and social sciences and these other fields, obviously, trying to get someone who's done humanities and looking for future jobs for them, that remains to be a question. How is all of this is going to evolve? So healthcare is in a strong position. The issue that's constantly being discussed is, how is AI going to impact the less alluring majors that there's less employment for? Also, well, let me ask you this: Are you concerned about those sister, campuses and their value to students at this point?
There's a lot of pieces of what you touched on.
I know, bad question. Apologies.
I'd like to address them all, but let me start with the last question.
Yeah.
I am not concerned specifically about our sister institutions and the Claremont colleges beyond the general concern that we all have about higher education this time, at this time. Some institutions, including the Claremont colleges, are quick in embracing the technology culture with students and for students and their curriculum, even humanities students, to make sure that when they come out, they have all the pieces or that well-rounded training so they can land the right jobs, even if they are in the humanities field. In fact, a number of our Claremont colleges also are advancing their science and engineering programs. So the concern that I have would be with other institutions where rightfully continue to appreciate the value of humanities, because this is something we should not lose. Humanities, social sciences, these are very important for society. But those institutions who are missing the opportunity to connect or complement these learning experiences for the students with technology, with AI, with other engagements, with society, as society is advancing in a certain direction, that's where you worry. When there's not that broad sort of experience that the student gets, which I'm not worried about at the Claremont colleges. You were right about healthcare is a growing industry. In fact, the Federal Bureau of Statistics is maintaining a growth percentage of 13% for healthcare professions through 2031, and that's higher than the average of all professions. And we're very pleased that we are serving that. And these are the professions, not just the medical doctors, but also other allied professions like physical therapists, occupational therapists, nurses, pharmacists, and all those professions. So we are in a good sweet spot, if you will, for the market that we are serving. Also, we are very proud of being having been ranked the #3 master's program in the US by Intelligent.com, and it is based in big part on the statistic that you shared that we are proud of, which is 90% of our students are employed or sign up for an advanced degree within 6 months of graduation from KGI. So Intelligent.com took this data plus the salary levels of our employees and the overall return on investment, and they've ranked us as such. So we're very pleased with that. It doesn't mean that we can just continue doing what we're doing or offering the same programs or content we are. We have to continuously improve, enhance, evolve, so we make sure that we're keeping up.
I asked this question of all of our guests, which is, it is hard not to compare this era to the Industrial Revolution era. There's just so much, analogies. I mean, obviously, late 1800s, you had electricity, you had car, you had, you name it, telephone. There was just so much excitement going on. Very similar to now in a different fashion, except from railroad all the way to, the 40s, 50s, we had about a few wars in between that, but we had about 100 years to to put people to work and to really retool. And people were not living, unfortunately, as long as we are. Unfortunately, we're living longer, but AI is coming at a fraction. The speed of AI adoption might be a tenth of what it took Industrial Revolution to take hold. And people are living well into their 90s now. So how do we deal with the job displacement that could potentially happen to, let's say, customer service, to people who drive cars, for even programmers? So the impact of these agents and AI and job displacement, do we have enough run rate to really not have massive unemployment in the coming years?
I think one topic, this is a very good point that you make, JP, but one topic also that we need to be talking about as we talk about this is the upskilling of the existing workforce, whether it's the training of the existing workforce or the evolution of that function or job description, if you will. And that's why anyone who's graduating from any program at any level of education, whether it's high school or a PhD and everything in between, they have to really embrace certain characteristics or competencies that will help them evolve over time as AI evolves, so they are not displaced. Even if you have a technology degree or a science degree, you may be displaced if you're stuck in the past with what you think your job is or how you should do your job. But you have to really be good at learning as a competency. Anyone graduating with any degree at any level, they need to know how to learn as part of their skill throughout their careers, because they need to learn how to embrace these technological opportunities or tools or platforms to advance how they do their job. As I mentioned, at KGI, the way we set up our learning ethos here at KGI is really learning by doing and by teaming. So you build that skill of learning when you graduate. The other one is interpersonal skills become very important in this environment, and it could be a bit of a counterintuitive thing, but really with the more technologies that we get to use and embrace, we have to invest more in interpersonal skills and emotional intelligence, because we cannot lose that human factor, the human validation in everything that we do as a society. So also employees, even the ones who are fully trained on technology, they still want to develop and make sure that they have the right interpersonal skills to grow in their careers. And that will be part of sort of their ability to upskill, having those skills. The other thing that is very critical as technology advances and the potential of job displacement is interdisciplinarity or interdisciplinary collaboration. One way to mitigate the loss of a specific job or a specific, value of a specific skill is to round yourself up with the knowledge of complementary and adjacent functions, jobs, professions. We actually do that at KGI. We work hard on connecting our students in the different programs with students in the other programs. We work hard on building a curriculum that combines the different professions and different perspectives, because that is important for the skill set, if you will, that each person should have. And you should not be narrow focused on one piece of knowledge or one area of expertise.
Love it. Last question. How is all this impacting your leadership style?
This is a good question. And I think I've embraced since I was a little kid, and I was fortunate to grow up in a household with both my parents were chemical engineers, and my dad decided to take his PhD for the learning value and strictly for the learning value. He didn't necessarily need it in his profession. So I grew up knowing that you got to learn all the time. So whatever we're doing and whatever I said about AI or technology is really my sort of approach to leading an institution, leading KGI into the next, future opportunities. So I learn every day. I learn from what I read, what I hear internally and externally, and work with my team on developing and embracing those opportunities. I like also, and you might have noticed that in how I answered your questions, I like to embrace these opportunities like AI positively. I want to see the positive impact first. It doesn't mean that I will not acknowledge or help mitigate the negative impact, but I want to focus on the positive first so we can embrace the opportunity and actually ride that wave in a successful way. And then along the way, we look at the potentially negative impact and see how we can mitigate it. And that gives you the opportunity to embrace rather than avoid. Because if you look at the negative first, then your tendency is to avoid it. I would say this is how I think, and it helps us embrace AI and other technologies and other advances for the institution.
President Abousalem, it's been a pleasure. Thank you.
Thank you very much, JP.
We hope you enjoyed this episode of the College Admission TV Presidential Podcast. Stay tuned for our next episode, where we'll bring you another insightful conversation with a distinguished leader in higher education.